Hey Proactive family, Dr. Brandon Evans here with Proactive Physical Therapy and Wellness. This month we are focusing on the knee, specifically knee pain or pathologies. So some of the most common injuries or concerns that I hear is pain in the front of the knee, or pain on the outside of the knee, or bone on bone. Now what we must understand is unless you had a traumatic event, whether it be a sports injury or a car accident, most times these issues can be addressed by either making sure that you have proper shoe wear, because if you have really flat feet, that's actually going to put your knee, it's going to turn your knee in, and it's going to put abnormal stresses to the knee. And I can speak to this on a personal level, because when I used to work in the hospital, I used to have pain right in the inside of my knee, and I have really flat feet. So it's when I got the right fitting shoe, they gave me arch support as well as an orthotic, I almost immediately took that knee pain out of the inside of my knee. Secondly, a lot of the muscles that stabilize the knee actually originate from the hip. So you have muscles in the front of the hip, in the inside of the hip, the outside of the hip, and the back of the hip. And they go and surround the knee to help to stabilize it. And an example that I can show you of this is individuals that come in telling me that they have bone on bone, and they believe that's where their pain is coming from. Now, when we talk bone on bone, if I'm going to use these dumbbells here as an example, so this will be the thigh bone, this will be the shin bone. So the bones sit like this, and then at the ends of both bones, you have what we call cartilage. And what that cartilage does is helps to distribute forces and give some cushion to the bones in layman's terms. So what happens when we get bone on bone is some of that cartilage starts to wear out. So you can see here, the dumbbell's yellow. It has a covering on it. But on the other side, you can see the covering is missing. So we'll call this where the cartilage is worn down and bone on bone. So if this is my shin bone, this is my thigh bone, my knee is supposed to sit like this. And we'll call, just for these purposes, this side will be the inside, this side will be the outside of the knee. So if we have improper shoe wear and we have flexibility or mobility deficits in the hip, as well as strength deficits in the hip, what can actually happen is the knee will go and start to sit like this, okay? Now when this happens, you can see that we're putting a lot more force, a lot more stress to where the cartilage is worn out. So what we want to do is ensure that we have proper flexibility and mobility in the muscles in the hip, as well as proper strength in the muscles in the hip, as well as proper shoe wear to get our knee from this position to this position. And as we do this, what we secondarily do is take the stress off of where the cartilage is worn out and put the stresses more dispersed throughout the knee. Now, by improving the flexibility, mobility, strength, and proper shoe wear, this will not give you the cartilage back, but as I showed with these dumbbells, it will distribute those forces from where the cartilage is worn down and where the knee is sore, to where it's dispersed throughout the whole knee how we want it. So to recap, unless you had some type of traumatic injury, ACL tear or meniscal tear or something like that, most knee pain can be treated with proper shoe wear and proper hip strength, mobility, and flexibility. So I hope this helps. If you have any questions, please reach out to us. Thank you. Have a great day.